step inside or step outside and I see a woman laying down conscious, I'm going to do my BSI. I'm going to survey the scene, check if it's safe. It appears to be safe. General impression, mechanism of injury, chest pain. She appears conscious again. I'm going to approach her and I'm going to establish a relationship. My name is Crystal. I'm a EMR in training. May I have permission to give you care?
Yes, please.
Okay, I'm going to assess the airway. Can you open your mouth? And check her breathing. Airway's open. She's verbal, so she's appears to be breathing. And check her circulation. Pulse is present. I am going to check for any bleeding. There doesn't seem to be any. I would reassess the ABCs appropriate within my assessment. May I ask what your chief complaint is?
Chest pain.
Okay. Right now I'm not going to do C-spine immobilization. Does your neck hurt at all?
No, it's just chest.
Okay. Can you tell me what you were doing when your chest started hurting?
Well, I was just like sitting out here underneath the tree having a picnic by myself, and it just like started hurting really bad.
Okay. Were you doing anything that provoked this pain?
I was just sitting there eating a sandwich.
Okay. Does anything make this worse or better?
Well, I tried to like sit up, and that really hurt me. Like just moving my chest area hurt. So I laid down and it felt a lot better, but it's still really painful.
Okay. Can you describe how it feels to me?
It's like a clenching pain, like a sharp clenching pain right in the middle of my chest.
Okay. On a scale from 1 to 10, 10 being the worst pain possible, what do you rate your pain?
I'd say like an 8 or a 9.
Okay. What time did it start?
I'd say about 5 to 10 minutes ago.
Okay. Do you have any associated symptoms with your chest pain?
Not that I can think of.
Okay. Are you allergic to anything?
No, I'm not allergic.
Are you taking any medication?
No.
Any over the counter?
No.
Recreational?
Occasionally.
Okay. Can you tell me about your past medical history? That may be
I
related.
haven't had really any issues, but I mean, I don't know if this is related, but my grandpa did die of a heart attack.
Okay.
Yeah, on my dad's side. So
Okay.
I don't know if that makes a difference.
Can you tell me what you had to eat last and anything to drink?
I was drinking lemonade, had a turkey and cheese sandwich, and some Doritos.
Okay. And how long ago did you have those?
10 minutes ago.
Okay. Can you tell me again what happened that made your chest hurt?
I was just sitting here eating my lunch, and all of a sudden my chest just started hurting really bad. So I tried to like move around different positions, and I laid down, and that made it feel better. So that's why I'm here, because this is the most comfortable for me.
Okay. Next I'm going to do check your vitals. So I'm going to take your pulse. And I don't have a watch on me, but I would monitor for a full minute. So I guess for a normal heart rate for an adult would probably be 70 beats per minute. And her pulse is strong and it's regular. And while I'm monitoring her heart rate, I would take a look at her respirations and also monitor for a full minute. She appears to be unlabored. Her respirations are regular and she has 20 breaths per minute. Next I'm going to check her skin, and because I'm already touching it, I'm going to say it's pink, it's dry and warm. I'm going to move to her blood pressure, and I'm going to do her neck, and I'm going to have an estimate of 50 if I... Okay. Pulse is present, so 50 for baseline blood pressure. I'm going to check her pupils, and I'm going to have you close your eyes, open them. Her pupils are round, equal, and reactive to light. I'm going to move to my physical exam. I'm going to start with the head first. And I'm going to start... Do you mind if I...
No.
touch? Okay. So I'm going to check and palpate her scalp, or her skull, and I'm going to check for any open wounds, bleeding, or deformity. There's none noted. I'm gonna check her ears for CSF. None noted. Check her nose for the same. None noted. Open your mouth. Her mouth. Okay, go ahead and close it. Mouth is open. Yes, nothing wrong with it. I'm gonna check her face, and I'm gonna check for any deformity or bumps. None noted. I'm gonna move down to her neck and check for an inline trach. It's inline. I'm gonna check for jugular distension. None noted. I'm gonna feel the back of her head and feel for tenderness on her vertebrae. Is any of that tender?
No.
Okay. Next, I'm gonna move down to her shoulders, and I'm gonna palpate her clavicles. Check for any tenderness, deformity. I'm gonna peek at your chest or your shoulders and check for any open wounds, bleeding. There's none noted. Next, I'm gonna move down to her ribs. May you take a deep breath?
It hurts.
Okay. She does have resistant to breathing a bit. There doesn't seem to be any deformity, or is it tender here?
Yeah, it's
Okay. So it's a little tender. Next, I'm gonna move down to her stomach. I'm gonna palpate in each 4 quadrant, and just let me know if it's tender.
yeah, that's tender.
Okay.
That's
Okay, so tender in the right upper quadrant. I'm going to lift up your shirt and check for any open wounds, bleeding. And there's none noted. Next, I'm going to verbalize that I'm checking her genital area. I'm going to touch her hips and see if her pelvis is tender. Is this tender at all?
no.
Okay. I'm going to do the extremities. I'm going to palpate each arm, and I'm checking for dots, deformity, open wounds, tenderness and swelling. None noted. And check your other arm. No deformity, open wounds. Can you squeeze my fingers? Okay. Strength is bilateral. I'm going to check her pulse also. Pulse is present in both hands. Can you tell me what I'm doing?
Rubbing the top of my hand.
Okay. And what about this hand?
Rubbing the palm of my hand.
Okay, sensation is intact. I'm going to move down to her legs. I'm going to palpate each leg, and I'm going to check for deformity, open wound, tenderness, or swelling. Any of that tender?
No.
I want to do this leg, any open wounds, deformity. Is it tender at all?
No.
Okay. I'm going to have you push up, push down. Strength is bilateral. I'm going to check for pulse in both legs. Pulse is present. I'm going to ask you what I'm doing to your leg.
Rubbing my ankle.
Okay, what about this?
Rubbing my shin.
Okay, so sensation is intact in both legs. I'm going to move to the back of her. I'm going to roll her to her side. So up, over, sorry, up. So on the count of 3, I'm going to roll you over to me. 1, 2, 3. Next, I'm going to check the back. I'm going to check for any tenderness along the vertebrae. Is it tender? Okay. Okay. Next, I'm going to lift up her shirt, and I'm going to check for any open wounds. None noted. Back of her legs, there's no open wounds. And no bleeding, no injuries. Okay, I'm going to roll you back. Okay, 1, 2, 3. Okay, and then I'm just going to verbalize that I'm going to monitor her vitals, like I said before, every 5 to 10 minutes. I'm going to treat her injury as such, her chest pain, so I'm going to wait. I should have called 911 in the beginning. And I would treat for shock, but she isn't in shock, but I would probably maintain body temperature and use soft skills.